At DSM, our premix solutions are never linear. They can be truly, fully customized to flex and fit, giving you a uniform blend. Packed with unique and high-quality ingredients, removing all the frustration, giving you the freedom to innovate. To get it right, we source all our inspiration from consumers, putting them at the heart of everything we do, from concept to formulation. With a passion for how our formulas fuel lifestyles, advance health, and meet the needs of today's consumers. We're here to help you create products with purpose that people need, want, and love to use. And we go beyond just ingredients. Our expert services are designed to streamline your entire product development process so you can get to market faster. And it's about doing it all with the care and quality your consumers deserve from a partner you can trust. Together, we can fuel your consumers' highest health ambitions and overcome your biggest product development challenges. Because where others see products, we see purpose. So whatever your challenge, together, let's find the perfect solution.
So yes, let's find the perfect solution. And today we would like to discuss the perfect solution for nutritional management of chronic wounds. And with that, I'd like to welcome you to the DSM webinar. My name is Christina. I'm the segment lead for medical nutrition in Asia Pacific. We started the webinar series for medical nutrition in APAC 4 years ago. And I've always been overwhelmed by the great interest and the number of participants joining these events. Today we have over 160 participants from not only 11 countries in APAC, but also from Europe and the US. And it's so great to have you all with us today. DSM is the #1 ingredient provider globally. And with that, of course, it is extremely important to us to not only deliver high quality ingredients and excellent services to our partners, but also to constantly inform and discuss about new developments, latest insights on nutrition topics that matter. And this is all with one purpose in mind: to improve the quality of life of the consumers, the patients, the healthy agers, the young and senior adults. And today we'd like to bring the topic of the nutritional management in wounds to your attention. We all know that energy and protein play an important role, but are there other nutrients too that are vital to support the healing of chronic wounds? Chronic wounds as a result from diabetic foot ulcer, for example. We know from international reports that the prevalence of diabetes is predicted to rise by 46% by 2045 globally. And whereas the awareness of the importance of proper blood glucose management is extremely high, little is known that 1/3 of diabetics will develop diabetic foot ulcers due to impaired blood circulation. And these foot ulcers are usually found in the areas of the foot that encounter repetitive trauma, and pressure sensations. And they are the most frequent reason for hospital admission for people with diabetes. Timely care can help prevent foot ulcers and with that improve the quality of life. The importance of the nutritional management in these chronic wounds is often neglected, and today we will hear more about it. And it's now my pleasure and honor to welcome our two speakers. Dr. Shukri from Malaysia. And Rachel, can you, do we do the housekeeping rule first? I apologize. My bad, housekeeping rules are important. So yes, a few housekeeping rules as always before we start. You are welcome to engage in our discussions and please type your questions in the chat box as shown here on the slide. If you might face any technical difficulties, please address them in the chat box too. And my great colleague from Singapore, Rachel Tan, is helping us in the back end. So very, very important. Thank you, Rachel. Also, we have uploaded a few handouts here that you will find in the chat box and you're welcome to download them. And now I'm super excited and feel very, very honored to introduce our two speakers to today's webinar. We do have Mr. Shukri from Malaysia. Hello, Mr. Shukri. Good day. Mr. Shukri is the president of the PENSMA Society, the local society of medical nutrition in Malaysia. Mr. Shukri is senior consultant for gastrointestinal and general surgery at the National Cancer Institute, Putrajaya, Malaysia. His special interests are in clinical nutrition and surgery, cancer, metabolic diseases, including obese patients, critically ill patients, and surgical prehabilitation. And I'd like to highlight one special achievement among so many achievements from Mr. Shukri, but I'd like to bring to your attention today is that he was extremely vital in establishing the nutrition support teams in hospitals across the country, across Malaysia. Mr. Shukri, it's great to have you with us today.
Thank you, Christina.
And then hello and good morning, Carol. Carol, our colleague, I should say, from the Global Scientific Affairs team at DSM. Carol has her office in the DSM headquarters in Switzerland. So good morning to you, Carol.
Good morning, or good afternoon where you are.
Carol is a UK registered dietitian with 25 years experience in medical nutrition. She started off as clinical dietitian to product development and scientific affairs. And Carol's special interests lie in amino acids, proteins, and their application in the medical nutrition segment. So with that, I believe we are good to go. And I'd like to give the stage over to you, Mr. Shukri.
Thank you, Christina, for the kind introduction. Good afternoon, my respected audience, or even good morning, very early morning, wherever you are. And I would like to thank DSM for this opportunity for us to actually share some of our experience in managing patients with regards to nutritional interventions. Specifically for this forum or webinar, we are going to talk about whether there are missing links in the managing wounds, especially chronic wounds like the diabetic foot ulcers, and how we can do better. So as you can see here, this is the outline of my presentation. I will talk a little bit on the global burden of diabetic food, the complexity or the pathology of the diabetic food, the financial and healthcare costs of diabetic food, and how we can do better to enhance healing in diabetic food. Next slide, please. So, ladies and gentlemen, this is the projection of diabetes from 2015 to 2040. 25 years from now, you can see globally, from every regions all over the world, you can see there's a significant increase, more than 50%. Okay, especially in the area of Africa and Southeast Asia. And this is not only the burden of the disease itself, but the comorbidities that comes with it, especially the complication of the diabetic foot. And in any one lifetime, especially for these diabetic patients, they have 1 in 6 risks among these patients to have diabetic ulcers in their lifetime. And to make it even worse, you can see here the estimated cost of increasing hospital costs and medical costs to the overall management of diabetes and its complications. So it's such a big burden to the healthcare costs now and in the future. Next slide. And apart from the diabetes itself, we have to also look at the prospect of the patients of getting quality of life. And the problems of diabetic foot is considered one of the top 10 of the disease-related disability among patients with chronic diseases. And this also impacts with the outcome of the overall treatment therapy, no matter what the problem or the comorbidities are. Next. And why it is very difficult? Because as we all know, in diabetes, there are multiple pathology that is affecting the development of the chronic ulcers, which I will explain further later. And majority of these patients, they comes in late, not because they refuse treatment, but because of the complexity of the pathophysiology itself, because the indolent, what you call this, nature of the disease and late detections. Okay, and therefore they are more often than not that they will end up with amputation of the lower limbs, and this will definitely affect the quality of life. And if we were to look at literatures, 90% of amputation in the United Kingdom, it is not because of trauma or other diseases, but because of diabetes related complications. And this is definitely added to the risk of infection, repeated admissions, and the delayed healing. And something has to be done, something has to be looked into, how we can improve this before it becomes, a major burden in the future. Next. And looking at the pathology, as I mentioned earlier on, which is very complex, you can see here there is an interplay between the issues of the disease affecting the vessels from the diabetes itself and the predisposing factors such as decreased immunity because of the diabetes, infection, and some of the triggering factors. For example, trauma. They tend to develop undiagnosed trauma because the sensory is affected. They can't feel any trivial injury to the foot, and therefore the moment when they realize it is already too late, the ulcer has become significantly large and deep. There is also issues of foot deformity, which is quite common among diabetic patients, and the fact that majority of these patients, they are malnourished, and with the deficiencies in micronutrients, we can expect the healing rate, the skin integrity itself are very much prone to cracks and abrasions and definitely a development of ulcers. So there's an interplay of a lot of pathology here, and definitely just to control the diabetes probably might not be the only solution here. So we have to look at different angles. Next. Now, as I mentioned earlier on, there are multiple pathology, and definitely this diabetic patient, they might have specific venous problem, arterial problem, or sensory related neuropathic problem that predispose the lower extremity to ulcers and all the complication from diabetic ulcers. And they can also come in with combination of more than one factors: venous with arterial, arterial with sensory problem. And end of the day, majority of these patients, they are very much incapacitated, being in the hospital for days and weeks. They are immobilized, even in their respective homes. Most of the time, they are immobilized in the bed, in the chair, and this further predispose them to pressure ulcers, whether it is at the sacral part, most dependent areas, and likely more in the lower extremities. Next. It is very difficult to detect early because, as I mentioned earlier on, the sensory is very much involved, and therefore to acknowledge and to detect the progression is quite late sometimes. And it depends on the stage of the progression of the ulcers. Okay, if it comes at the stage 1 and stage 2, perhaps it is still subject to the remedies and the treatment options. They might heal completely. As it go to the progression from stage 2 to stage 3, the complexity of the treatment might require multimodality approach, and the dressing and the technicality might even require higher requirement of surgical debridement or even specific dressing material. And if you can see here, once it become gangrene, amputation is always imminent, and sometimes it might cause mortality, high risk of mortality because of severe sepsis and infection. So if you can see here, the progression is becoming even worse if we cannot deal with it from the very beginning. And we have to remember, sometimes healing process might get prolonged. It might not happen at all. So can we even look or solve this problem before it happens? Next. This is a very good study in the States looking at the data of diabetic patients. This is a nationwide inpatient sampling, close to 1 million cohorts of diabetic patients. If you can see the graph on your left-hand side, those are the etiology of the the food-related ulcers. I wouldn't regard the gangrene as part of the etiology because I think it is mostly the end part of the progression of the disease itself. But most important thing here, we like to show you the right-hand side of the graph, where you can see diabetes-related food complication comprises more than tenfolds of the risk of admission to the hospitals. Okay, and it is just made worse by the co-infection because of the non-healing wounds. You can imagine the impact on the cost of hospitalizations. Okay, next slide, please. And looking at the different types of stages of the progression of the foot ulcers and its related treatment, if you can see here, the overall cost, with or without infection, it is escalating. With amputation, it comes up to close to $12,000 USD. Okay, with infection, it can come up to $15,000 dollars. Okay, and per patients. And this is, of course, it depends on different countries and different regions whether it is completely reimbursable or fully subsidized. But whatever it is, end of the day, it is part of the economical burden that has to be shouldered by any one country and society and the patient themselves. Next slide. Now, this is a recent study looking at the representative of each region, comprising Africa, Asia, Middle East, South America. The amount of cost of hospitalizations and how much has been spent and to what part of the treatment for the diabetic ulcers. If you look at the African region, 1,800 USD is spent per patient for the management of diabetic ulcer, and they spend basically for medication, antibiotic, dressing, surgery, and diabetic control. Looking at Asia, again, antibiotic, dressing, and all the technicality that has got to do with improving the healing process. And that comes up to about 19,000, close to 20,000 per patient. Look at Middle East, debridement, antibiotic. Basically, these are all the technicality of managing the ulcers, try to reduce the burden of the necrotic tissues. But nothing is mentioned here about nutrition. How does the wound going to heal if you do not support the healing process? Looking at UK data, in 2018, they spent about £2,000 per healed diabetic foot eventually. Okay, for the non-healing, the repeated treatments and admissions, it comes up to £8,000, and per amputated diabetic foot is close to £17,000. So the impact, the economic impact. Next slide. To understand the process, whether one wound could heal according to the expected time, we have to understand the healing process. And basically, healing process will involve 3 or 4 stages. Basically, the first stage is the inflammatory phase, where the clotting process will start to set in. And the most important thing is that the immune response has to kick in to contain the infection, to contain the inflammation from getting worse and spreading to the surrounding adjacent tissues. And if this goes well, then only the body can support the next process, which is what we call as proliferative phase, where the building blocks for tissue regenerations, tissue growth is going to be implemented in that affected part, which involve deposition of collagen, fibronectin. And usually this will take about days to weeks, okay, where eventually in the final stage of wound healing, the maturation phase will set in, where it will take weeks, and this will involve strengthening the tissue matrix, and therefore complete healing is ensured. And any part of this healing process may be interrupted, impeded because of the concurrent disease, the co-infection, the burden of infection itself, and of course the inadequate nutrients to support healing, to support the tissue regenerations. Okay, and therefore we need to know what is required for wound healing. Next slide. So before we go into the nutritional requirement, I just would like to get your attention to one of our recent study. This is a study done by our colleague in the Philippines, looking at 11 Southeast Asian countries at the prevalence of malnutrition. And this is a big cohort. And I can ensure you from this cohort, you can see a lot of them comprises among the elderly, immobilized. They got a lot of comorbidities, and basically diabetes is one of it. And pressure ulcer is very common. And you can see here the prevalence of malnutrition is somewhere between 50% to or close to 90%. Okay, we can put aside the cancer patient there, but generally the chronic comorbidities and the clinical consequences because of immobilization, malnutrition, and the comorbidities is the development of pressure sores, infections, delayed wound healings, and it has actually caused increase in the hospitalization costs more than 20%. Okay, and for Southeast Asian country where the GDPs are not as high as the Western countries, and the amount spent, the percentage of budget that's spent to the healthcare is not that much. The patient will definitely get the the impact of prolonged non-healing wounds, and this is a continuous issues in Southeast Asian countries. Next slide. So we have mentioned about wound care. It is very known to everyone that for all diabetic patients, especially, diabetic control is very important. And I'm sure in any diabetic patients, this is the first and foremost issue that has to be handled by any physician, surgeons, or anyone that has the stakeholder in the managing diabetic patient. And every effort has been taken into wound care and control diabetes. And of course, every now and then, surgical debridement is one of the requirements. I'm sure try to get the patient to ambulate, physiotherapy, reduce the edema, foot elevation, and all sorts of compression is there. But how about the nutrition? Next slide. So looking at the International Working Group recommendation for diabetic food, they have come up with 13 recommendations. I'd just like to bring you to the last recommendation. Next slide. There's been a controversial here that the statement did mention do not use intervention to correct nutritional status. That means supplementation with proteins, vitamins, trace elements in preference to standard of care. And this has actually created a lot of anxiety among healthcare professionals, because if you were to read the statement properly, this is in preference to standard best standard of care. And coming from this, if you look at the 2021 Australian guidelines for the management of diabetic food, next. Can we have the next slide? They have actually adapted this recommendation, but downgraded its recommendation from strong to weak, and highlighted that there shouldn't be any confusion with the appropriate use of nutritional intake for general health and well-being to be maintained among all this sort of patients. Okay, and looking at the other guidelines that is available, especially for pressure ulcer. Next slide. Which is probably a little bit different in etiology, pressure ulcers and diabetic ulcer, but basically they are chronic ulcers. Okay, the daily requirement for nutritional intake that is essential for wound healing, collagen synthesis, angiogenesis are very important. Okay, and this has been supported by multinational society with regards to the management of chronic wounds such as pressure ulcers. Next slide. And if you look at the specific recommendation under the section of nutrition 4.0, you can see here it is highly recommended to actually offer the patient high calorie, high protein nutritional supplementation. And if you look at the recommendation section 4.10, the provision of arginine, zinc, and antioxidant is highly recommended for this sort of patient. Next slide. And with that, ladies and gentlemen, you can see when we were to actually manage our patient, of course, the nutrition intakes are very important. That is all the factors on the left-hand side of this slide. Okay, calories, protein, fats, fluids are the integral part of nutrition. But the other supporting micronutrients is very important to ensure healing is on the right side of the slide here. Vitamin A, vitamin C, that comprises some of your antioxidants, iron, zinc, which is further on will be dealt with in depth by our co-speaker, Carol. And I think I'm coming up to my last slide here. So in conclusion, ladies and gentlemen, there is a significant disability and burden from the exponential increase in diabetes-related food ulcer, as we can see earlier on. The complex and overlapping pathology in diabetic foot ulcer makes it even more difficult to treat. And there has been too much of focus on technicality of treating wound, and physicians, surgeons, all healthcare workers has been neglecting or ignoring the requirement of the nutritional requirement of patients. Specific nutrients have definitely functions to support various stages of these wound healings. With that, thank you for your attention.
Thank you very much, Mr. Shukri. Amazing. I was particularly impressed to understand the burden of the healthcare system, the cost spent to really treat these chronic wounds. Thank you. If that's okay with you, I can see already questions coming up in the chat box. Are you okay to take one or two before we move on to Carol's part?
Yeah, sure, Christina.
So Mr. Shukri, there's one question on, which is an interesting one, a common one probably. Why, according to your opinion, experience maybe, why is the importance of nutritional management in chronic wounds ignored? Or why is the awareness poor? And why, yeah, sometimes maybe we can even speak about ignorance. Do you have an opinion here?
Right. Okay. I can divide this into two parts. Okay. Number one is the healthcare professional themselves. Number two is the patient. Okay. To start off with the healthcare professional, nutrition is not in the syllabus of medical schools for doctors, for nurses. Okay, unless if it is for nutritionists or dietitians. So that is the part where if you look at 10 years ago and comparing today, so there are more effort now has been put into implementing nutrition as part of the syllabus, and the awareness was not much more better than 10 years ago. And with the flourishing of societies, nutritional based societies all over the world, the concern now, especially in critically ill, chronic diseases, diabetes, chronic kidney diseases has improved nowadays. On the second part is the patient themselves. Chronic patients, okay, particularly diabetes, they are, to start off with, they are malnourished. And we have to understand here, treating malnourished patient, either you replete the loss and then you have to supplement. So the process is ongoing. Sometimes if you just supplementing but you fail to replete the losses, it won't help, it won't benefit the patient. And to counsel the patient, to make them understand, is very important, because this is a two-way kind of thing to communicate with the patient and to make them understand. I hope that will answer the question.
Sure, it definitely does. Thank you, Mr. Shukri. Another question, if there's a trend for the treatment of chronic wounds, in particular diabetic ulcers, diabetic foot ulcers. Can you see a trend coming up, or I
think I just touched superficially on the recommendation that has been suggested by the International Working Group on Diabetic Foot. If you can see the 30 recommendation, the rest of the recommendation, except for the nutrition, they are talking and specifically on the technicality. If you look at the type of dressing, hyperbaric, oxygen, topical oxygen therapies, and all this, these are all the technicality to improve or to enhance healing. Okay, so that are the trends now. Okay, but the part that is a little bit sad and a little bit disheartening here is that the basic nutritional requirement is being ignored.
Yeah. Super. And maybe with today's event, we can help to increase the awareness,
Exactly.
on the importance of the key nutrients here, the key ingredients in solutions for chronic wounds. Thank you, Mr. Shukri. And with that, I'd like to hand over the microphone to Carol, our great colleague based out of DSM head office in Switzerland. Good morning again, Carol. And
Good
Carol,
morning.
I can already see questions in the chat, and the questions are as follows. If there are any nutraceutical supplements to support the healing of chronic wounds, of diabetic foot ulcers, or also another question, very excited to read that, which nutrient contributes to wound healing? So I guess, Carol, you will be addressing all these questions in your presentation now, aren't you? Carol, over to you.
I certainly hope so. So thank you, Christina. Thank you for the introduction and the opportunity, obviously, to present and to share some thoughts from DSM on this very key subject of wound healing, in particular in relation to sort of chronic wounds and diabetic foot ulcers. And thank you to Dr. Shukri for an excellent grounding there in the world of wound healing or wounds and diabetes and the burden that it puts on the global health system, because it is a bigger problem. And
yes, Carol,
hopefully except my slides don't move.
Can you try again?
Sorry. I'm trying to move them. Nothing's happening.
One more time.
Yeah, there we go. Technology. Never my friend. But anyway, okay, let's go on. So at DSM, I mean, we look at wounds. Wounds can really include a lot of different things, such as the pressure ulcers or the bed sores as they were once known. It can be wounds from surgery or from trauma, or as you've heard from Dr. Shukri, the wounds or the ulcers from conditions such as diabetes. And we see nutrition as an important factor that is modifiable, which is the important part. We can influence something to support the wound healing. And without this adequate nutritional care, then wound healing can be impaired or even not take place. It can take really quite a long time for any wound to heal. And I like to think about wounds really as in terms of sort of planned or unplanned wounds. And you usually have sort of the surgical wound is usually something that is planned, whereas a non-surgical or accidental wound is usually unplanned. And in surgical wounds, as you can see on this tree, this can further be divided into what we call acute wounds, which are sort of a one-off incision that would hopefully heal as would be expected, or a chronic wound that is maybe a planned incision, but then doesn't heal quite as quickly or as expected, and can become infected and therefore take much, much longer to heal. Your non-surgical wounds are really those that arise acutely from sort of accidental injuries, such as burns or cuts or tears to the tissues if you cut your finger, something like that. Or even the area that we look at today, which is the more chronic wounds, which result as the result of some other influence, such as the pressure sores, or as a consequence of something like diabetic foot ulcers. And if we look briefly at the development of pressure ulcers, and these are really sort of malnutrition and prolonged bed rest are really the biggest risk factors for developing pressure ulcers. And these come about as an injury to the skin as a result of constant pressure, mainly due to impaired mobility. And this is not just people who are lying in bed in hospital. It can be people who have reduced mobility because maybe they're confined to a wheelchair or they just don't walk as well as they used to. And this pressure can result in reduced blood flow and eventually can cause the death of some cells, skin breakdown, and this leads to the development of an open wound. And it's estimated that around 1 to 3 million people in the US will develop pressure ulcers every year, and of those, around 60,000 people will die from complications related to these pressure ulcers. So it's quite a serious problem. And wound healing, as you've already seen by Dr. Shukriya, is a stepwise process that we've probably all seen in action and tend to take for granted when it's happening to us, unless something goes wrong. And the steps in the inflammatory phase are the first few days where you see the redness, the heat, the pain, and the swelling. And then in the maturation phase, the wound starts to heal with the new tissue formation and eventually the new skin to close the wound. But to achieve appropriate healing and functionality requires nutritional therapy, especially when the patient is malnourished or has the stress of a chronic disease such as diabetes. And as Dr. Shukri was showing earlier, the reason we focus on diabetes is because there is a much higher risk that if the blood sugar is not well controlled, then this increases a risk for poor wound healing. And the blood flow and the nerves that are present in the tissues can be damaged due to the high blood sugar. And diabetes seems to be an ever-growing problem. And the increase in the amount of people living with diabetes really is quite substantial. So they're expecting to have a more than 40% increase in people with diabetes by the year of 2045. This is where nutrition can really play an important role. And in order to support this wound healing, then different nutrients may support different stages of wound healing. Although some, such as the energy provided, the protein provided, and the fluid are required throughout, but there are certain nutrients that we focus on that may be required in the different stages here. And they may be required in amounts that are over and above the standard nutritional support. So, for example, your vitamin C and zinc may be required in something like twice as high as the normal recommended daily intakes. And at DSM, we've thought about the main nutrients really and divided them into those that look at supporting your muscle nutrition and your skin nutrition. And it's always important to have an overall balanced diet with the fats, the carbohydrates, and the fluids. But in wound healing, as well as the many smaller tissues that need to be repaired, like the blood vessels and the nerves, the two main organs, the muscle and the skin, have certain nutrients that are linked to healing for these areas. The muscles and the tissues for support of the damaged area, and the skin will be the ultimate seal or the barrier to close the wound. And we'll look at these in a little bit more detail. So if we start with everybody's favorite, protein is really essential for many processes in the body. But in relation to wound healing, we're looking to protein as being the foundation for the tissue repair. And protein is made up of the building blocks called amino acids. And whereas most dietary sources, sort of chicken, fish, or the non-meat alternatives contain a range of amino acids, two of these amino acids in particular are useful when it comes to wound healing. And these are arginine and glutamine. And arginine is what we call a conditionally essential amino acid. And this is involved in the protein synthesis and the deposition of the collagen tissues. And it also has a role in promoting wound strength. It promotes a better immune response, and it also improves the vascular functions. Glutamine, again, is what we call a conditionally essential amino acid. And the main role of glutamine in wound healing is really as a source of energy for cells when a case arises that there's rapid reproduction needed, which in wound healing, this is one of those situations. And therefore supplementation of dietary protein with arginine and glutamine is often recommended for wound healing, where the stress of any illness or condition may lead to depletion. Certain vitamins have different roles in wound healing. And vitamin D has many roles, really. And sorry, slides aren't moving. Ah. Okay, right, we're moving again. Sorry about that. So first of all, the vitamin D, it works together with the amino acids and helps to contribute towards building the muscle that will support the wound heal. It can also help dampen down any inflammation that may be present and strengthen the overall immune system to react to any potential infection. And what's been shown is people with diabetes often also have low levels of vitamin D, and they have been shown to have more problems with their blood vessels, which may in turn restrict the blood flow to the wounded area. So supporting this with vitamin D supplementation has been shown to help reduce ulcer size, in particular in diabetics with foot ulcer. Another crucial vitamin is vitamin C, and this can not only helps to support an effective immune system, but is essential to support tissue repair and regeneration. And its primary role is in the synthesis of collagen, which is an important protein that helps to build the connective tissues and help to knit the wound together and to allow it to heal. Vitamin C may also help to boost the speed and strength of the wound healing. And as vitamin C isn't stored in the body, there may be an inadequate supply in times of high demand, such as when the wound occurs. Therefore, we believe that supplementing with vitamin C may help to support and maintain wound integrity. Other vitamins, such as vitamin K, is neither needed for the help in the blood clotting process, which is obviously very important for wound healing. And being deficient in vitamin K may lead to continued bleeding at the wound. So we believe some supplementation with vitamin K may help to promote the blood clotting. Vitamin A is needed to support the tissue formation, and a deficiency may decrease the resistance to infection and therefore delay the wound healing. And supplementation can therefore be important with vitamin A to help support and maintain the wound integrity. Vitamin E is another very useful vitamin. It has a role in protecting the cells from further damage and may also play a role in reducing some excess scar formation when the wound is healing. So supplementing with vitamin A has been shown may accelerate some of the healing of chronic wounds. If we move on to minerals, mineral zinc plays a crucial role in many processes such as protein synthesis and the collagen formation and cell replication, as well as helping to maintain a healthy immune system. And for this reason, we believe including supplementation with zinc may help to promote the formation of a strong tissue repair. Calcium's main role in the wound healing process comes in conjunction with vitamin K and is linked primarily to the initiation of the blood clotting at the site of the wound. And therefore, we would propose that supplementing with some calcium in conjunction with the vitamin K may help to promote the blood clotting. Selenium is another nutrient that has a role in protecting the cells and helping to deal with any inflammation that may be present. A deficiency has also shown to increase the risk of acquiring infection, and therefore supplementing with selenium may help to reduce this chronic inflammation that is present for people with chronic wounds, diabetic foot ulcers. And why do we believe in particular in these nutrients is that there are already some products and some studies that have been carried out in different countries with different combinations of nutrients. And we think that these studies and the outcomes of these show that the combination of nutrients could further be built on. You know, they've shown good potential. We can build further on it. We can add things to these already out there combinations. And the first study that I would show you is a one where arginine is supplemented to a traditional nutritional support. So these people had a range of different types of ulcers, so including diabetic foot ulcers and pressure ulcers. And they consumed, on average, 2 servings of a specialist wound healing product, so an oral nutritional supplement, something your normal sort of 40 ml or build-up type drink, but with added arginine. And they consumed this for up to 12 weeks. And what they saw was that within 2 to 12 weeks, 31% of all of the ulcers were completely healed. And of those that were completely healed, 40% of these were in the diabetic foot ulcer range. So this was a good outcome. And the diabetic foot ulcers that were grade 2 and 3, which is where you actually have a break in the skin and you can see through to the tissues, as Dr. Shukri showed you in some photographs. You know, they saw that these had a 40 to 100% reduction in this size of wound. And in pressure sores, one of the small pressure sores, it was a grade 2, but it was quite small, was completely healed within only 2 weeks. And out of all of the patients, all of these 26 patients, only 3 ulcers showed no change in their, or no improvement in their healing. So this was quite a promising result, that arginine supplemented to the normal nutritional support could give some benefit to wound healing. A second study I will show you showed this was a product that was just merely a combination of some amino acids, some arginine, some glutamine, and some HMB. And this was given to patients for 2 weeks in addition to their normal diet. And what they did, they'd actually made an artificial wound in the people's shoulders, and they had looked at what happened to this wound over this time. And one of the things that they measured is a substance called hydroxyproline, which is an indicator of collagen deposition. And if you remember, we've talked a bit about the collagen deposition being the basis of good wound healing, the start of the formation of a wound healing. And this specialized amino acid mixture led to a significant rise in plasma arginine levels, which you would expect if you give somebody more of something, then it's going to show up in their blood, is quite usual. But perhaps the key finding was the significant enhancement of the collagen production, which is shown here in this graph. as the hydroxyproline, and this is abbreviated to OHP. And you can see there that the amount of this, which indicates the deposition of collagen, is significantly increased in those that took the wound healing product. So, as well as the high protein, high energy diet, we believe that we should supplement with arginine and glutamine for wound healing where the stress of illness may lead to depletion, with the vitamins A and C that may help to support and maintain the wound integrity, with vitamin D, which has been shown to help reduce ulcer size in patients with diabetic foot ulcer, with vitamin E, which may accelerate healing of chronic wounds, with vitamin K and calcium, which may help promote better blood clotting, and with selenium, which may help to reduce some of the chronic inflammation, and with zinc, which may help to promote the formation of a strong tissue. And we believe putting all of these things together in a nutritional concept is a way forward to hopefully help to enhance wound healing. And with that, we're now happy to take questions.
Thank you so much, Carol. Thank you very much. Very, very interesting. Carol, can I just start right away with a question that came in the chat box? Basically, you are presenting nutrients that we already know about. Yeah. We heard about all these nutrients. You highlighted very nicely that some of them are needed in an amount as twice as high as the recommended daily intake. Would you also, from your point of view, would you also say that the secret of success and the benefits lies in the mix because they might have synergistic effects?
I think what has been shown is a lot of these nutrients have been shown on their own to have certain good effects. And the idea of our concept is really to put them all together and to take the best from all of these interventions that have been carried out, really. And the belief that if you can give somebody all of these things together in a palatable formula, then you know it's almost like it's an easier way to get all of these nutrients rather than them having to consume, you know, either vast numbers of pills and tablets to get them as vitamins and minerals, or to consume huge amounts of food to get the equivalent in their food. So yes, so it's putting together all of the knowledge and all of the research that's already been done on combinations of vitamins and taking that and putting it together to hopefully make the best of all worlds.
Sure, fair enough. It's basically all in one to maximize benefits, isn't it? Question to you, Mr. Shukri. When would you start supplementing with these key ingredients on top to a normal diet? What would you consider as the best time to start supplementing with such key ingredients in a patient that suffers from chronic wounds?
All right. As we all know, we are not the expert in every professionals. Okay. For example, in this region, mostly we are very dependent on nutrition support team or nutrition therapy. And that's how we work. So we work as a team in a multidisciplinary professional background. So first and foremost, we have to stratify this patient whether they are malnourished to begin with. And therefore, we have to start off with replenishing what is lost. And very important among these chronic patients, they might be in refeeding syndrome. So I do not want to delve with in depth about refeeding syndrome, but basically we have to start the resuscitations and the basic requirements. Once we can see that the patient is stable with regards to the disease, with regards to the infection, with regards to the sepsis, then we can supplement with these key ingredients, whatever there is, whatever region that is available, because sometimes the key ingredients might not be available in most products, right?
Right.
That's what Carol has mentioned just now, the palatability, especially in region like Asia. You know, people are not used to vanilla taste. So palatability is very, very important.
Right.
It plays an important, issue in the selection of this key ingredient. So basically coming back to the question just now, once the patient are stable, it is best and it is safe to initiate this kind of specific supplementations.
And would you agree that if the patient is not in hospital but at home, to start as early as possible once a chronic wound and complication occur?
Yeah, definitely. To me, whatever it is, when they are brought back to the attention, to the medical attention, so that's where everything starts. So whether that involve repeated admissions and basically at home, the first consultation in the hospital has to be very clear. The patient themselves has to know that this has to be an ongoing supplementation throughout the recovery of their wounds.
Super. Thank you, Mr. Shukri. And then I see a question whether DSM is offering a premix solution for this particular category. I'm happy to take that question. Yes, we do. And today it's basically the start to introduce this new premix solution to our partners and at the same time learn about the benefit about these premix solutions that contain all these ingredients as highlighted by Carol. Carol, last question with please a very short answer if you don't mind. What would you consider as the best application format for such a solution? Would you consider a powder? Would you consider a ready to drink? What's your view on this?
With me, I'll start first.
If I may give this question to Carol, Mr. Shukri, sorry.
Okay, sorry, I wasn't clear if you wanted me. I mean, I would say probably as a global formulation, then a powder that can be very easily mixed with water into a small drink. Then this can be taken with whatever protein source the person is using or taking, and this means that, you know, this gives the opportunity that the person can still join the family meals, use the protein in the family meals. They can still be part of it, but they have a little extra drink that they take with it, with their extra supplementation. And I think this, you know, it maintains something of the normality of eating, because eating is not just about food and nutrients, it's a whole social interaction and things. And you know, as I mentioned before, if this drink is made up into something that is palatable, then, you know, people will take it quite easy. So, you know, some quite inoffensive flavor, you know, and as you say, not everybody likes vanilla. But I mean, vanilla is used more because the smell of vanilla helps to stimulate saliva. That's why vanilla is used as the primary flavor in a lot of the supplements, but it's not to everybody's taste. So I think you know, we have to look at things like, you know, could it be more like a juice or something like that that we have, that people can use as a drink to go with their meal, and then it's taken in conjunction with protein, and you get the best work out of it.
Thank you very much, Carol. I understand that powder is always a good and convenient format to use for consumer, and maybe we can consider an orange taste here as well, and not always go with vanilla here. I apologize to the speakers. I know we have so many more questions, but I also have to have an eye on the clock. I apologize for that. But I definitely like to thank you both for a fantastic, excellent presentation on the topic. Thank you very much to Carol in Switzerland, Mr. Shukri in Malaysia. Always a pleasure. And to you, to the audience, for sending in all your fabulous questions. It's been a great and very fruitful 60 minutes, I believe, and we trust that you got some good insights and inspiration out of the presentation and also the discussion. And I wish to say a big thank you. And with that, I'd like to invite you to maybe scan the QR code that Rachel put on the screen for us here to learn more about medical nutrition in DSM. And we always value your feedback so very much. So there will be a very short survey at the end of the webinar. If you can, please let us know your comment, your thoughts, suggestion for improvement and next topics to discuss. We can only get better and we appreciate your feedback. With that, thank you very much. Stay well and goodbye.
Right.